Hi, and welcome to this episode of The Waiting Room. Today I'm talking with Mary Wilson Trider, the President and CEO of the Almonte General Hospital in Fairview Manor. I think it's really appropriate, Mary. People are interested in kind of how are things going in the hospital and the manor.
In some parts of the hospital, like our medical surgical unit, our activity is much as we would expect. Other parts of the hospital, the surgical program, our clinics, our day hospital, where we've unfortunately had to slow down the programming, we are not as busy, and those staff are working to help in other parts of the hospital. We are very much missing our volunteers and very much missing the visitors who would come in and see our patients and our residents in both the hospital and Fairview Manor. People who come into the hospital are screened, whether they're staff or physicians or patients coming in. A number of people inside the organization, particularly those who are working directly with patients or in areas like our kitchen where they are preparing food for patients, they're wearing masks right now. If we think there's a risk of somebody having COVID, there is other protective gear that our staff are wearing, gloves and gowns and that sort of thing. So it's business as usual in some respects and not quite as usual in others.
Actually, that's a perfect segue, Mary, because it is business as usual. The hospital is still operating the emergency department for other people.
Yes,
There's
it is.
still babies being born.
Yes.
You know, how is it affecting those sides of I'm going to say, the business?
Yeah, so in our obstetrics program, we have had some people who are choosing to deliver with midwives think about having their babies at home rather than coming to the hospital. So we have had a little bit of a reduction in activity because of that. But certainly all of the patients of our GPOBs, the patients of our obstetricians, and some of our midwife patients are continuing to come, continuing to have babies. And of course, we celebrate every one of those. Our emergency department is quieter than we would normally experience. Our volume is probably half or less than half of what we would expect. And we are frankly a little bit concerned about that because there are people who need our services who are thinking, oh, I shouldn't come to the emergency department because of COVID. And occasionally that means that people's health is negatively affected because they're delaying a decision. So people who are feeling unwell, who are feeling that they need to come to the emergency department, please come. We are here, we are open for business, and we want to make sure that we're taking care of you as you need to be taken care of in a timely way so that you can return to health and get on with the rest of your life.
These situations, I mean, something like a pandemic or, you know, the ice storm or the tornado, or they often bring out the best in people.
They do.
In the last 2 months, what kinds of things have you seen, Mary, that you thought, oh my gosh, people are stepping up?
I've seen all kinds of things, and you're absolutely right. These times do bring out the best in people, and certainly when we go into something like this, and as we start to think about the changes we need to make in our operations, like not having visitors, like asking staff to be screened and so on, we think about the guidance and direction that we're getting from the Ministry of Health, from Public Health. Things change rapidly and decisions are made, and then perhaps we get some guidance and we need to do something a little bit differently thanks to the expertise of Public Health. And our staff have been extremely flexible and adaptable. As we've said, please change this, please change that, please do these things differently. There's been a lot of terrific work on the part of our physicians and our staff in thinking about what we might need to do differently, how we keep people safe, and they've really stepped up to do that planning for us. We've had leaders in the organization taking on roles and responsibilities, even for a short period of time, just to fill in if we've needed something in a hurry. On a personal level, there have been numerous acts of kindness on the part of our staff towards patients and residents whose time in the hospital is longer because they're not able to have visits from their family members. We've seen staff members who just go that little extra step to make a patient or a resident feel welcome and feel loved and feel cared for. Over in Fairview Manor, the staff, particularly the recreation staff, have done an outstanding job of making sure that our residents can stay connected to their families. They've been using FaceTime and window visits and doing everything possible to keep the residents connected and also make sure that the family members know that their loved ones are safe and well inside Fairview Manor. I would also say we've had tremendous kindness from the community. This beautiful sign, which appeared just yesterday, I think, is one example of the kinds of things that people in the community are doing for us to express their appreciation, and we are very grateful for the things that they're doing as well. The gifts of food, the people who are sewing for us. We've got a fabulous wall of art up in the hospital that children in the community have made for us just to give us a lift and make sure the staff know that they're appreciated, and that is just wonderful.
One more question, Mary. What can the public do to help?
Well, the most important thing the public can do to help is to pay attention to the guidelines, the restrictions, the directions that we need to all live by to make sure that we get this COVID thing out of our community. Stay at home, wash your hands. If you have symptoms, make sure you're isolated. Keep yourself safe, keep the people around you safe, and let's get rid of this thing. On other notes, certainly we've appreciated the gifts that have come in. We very much appreciate things like this, where all of our staff have the opportunity to know the kind of appreciation we have from the community. And of course, as we know, our ability to make sure that we've got the equipment we need in the hospital, the equipment we need in Fairview Manor, relies entirely on the generosity of our community to make sure that they're supporting the work of the foundation so that we have funds to buy equipment when we need it to provide excellent patient and resident care.
Thanks very much, Mary. Stay safe.
You too.